Hello, and welcome to Rise Unwind. I'm Chris Malony. Each week, we connect with people across the country to share ideas, inspiration, and simple ways you can enjoy life right in your own neighborhood.
We're actually trying to help them reach their goal of clearing over 750,000 pounds of trash from the ocean and waterways across the country.
So sit back, relax, and let's rise and unwind. Business travel used to mean flying in, taking the meeting, and heading right back home. Now a lot of entrepreneurs are trying to make those trips a little more worthwhile, whether that means building relationships, extending the stay, or mixing in a little personal time too. We're joined by Vidack from Capital One and Lindsay Silberman, founder of Hotel Lobby Candle, to talk about how business travel is changing for small business owners. Welcome to you both.
Thank you. Great to be here.
Lindsay, when did you first realize your work trips were becoming more than just quick business stops?
I think it was probably after I started burning out from constantly going in and out and making the trips just shorter than they had to be. Probably the first time I did a trip and then I added on an extra day or two to explore a nice hotel that maybe I have never had the opportunity to stay at. And I realized how lovely it is to not be so rushed. I think that kind of gave me the idea that maybe I should do this more often. And so now with my business travel, I always try to incorporate a little bit of personal time either before or after the trip.
As Hotel Lobby Candle has grown, how has the way you travel for work changed too?
I think it's changed significantly. I think, I look at every business trip opportunity as a way of getting inspiration for a new place, making a connection, meeting a new retailer or a partner. And I think, it's just definitely, I also, as we've grown, I have to be more strategic about how I'm getting there, the money that we're spending and making sure that those dollars can get put back into the business through rewards and miles. Ami and I have talked a lot about how Capital One Venture X business is great for small business owners. It's what I use. And it's one of the things that I've learned, a little tool in my toolkit, I guess I would say, as a way of just making my business travel a lot easier.
Are you seeing more entrepreneurs move away from those fast turnaround trips and try to get a bit more out of the experience?
We've been hearing a lot from our customers that they want to spend a little bit more time traveling. In fact, I think there was a recent survey done by SAP Concur where 2/3 of business travelers said that they were very willing to travel. And the reason that they want to do that is because they're seeing the benefit of building relationships face to face. And so when they're traveling to new cities, they are extending their trip maybe just beyond kind of an in and out, and they're staying a little bit extra to either have dinner with a client or a vendor or attend an event together so that they can really build that relationship and build trust, which is really the foundation for that partnership for their business in the long run as well. And then we're also seeing travelers, business travelers in particular, take a little bit of extra time, as Lindsay talked about, really focusing on maybe an extra night to recharge or rest. We know that entrepreneurs are very busy. They're working very hard, many times not taking any time off. And so if they can sneak in an extra night when they're on a trip and maybe take a new city in and just relax a little bit, it can be really, really beneficial both for the entrepreneur and their business as well.
Ami, some of the best connections happen outside of the actual meeting. What kinds of moments are proving the most valuable for business owners?
Yeah, as I said, I think that what we're hearing from business owners and our customers is that it is the time after the meeting that is sometimes the most valuable for them with those folks that they're meeting with in that city. And so again, it's the grabbing the drink after the meeting and the casual conversation, or it's the dinner or attending, going and visiting a museum together with a business partner, where those casual conversations really evolve into a trusting relationship on which they build their business over the long term.
And for entrepreneurs trying to travel smarter, what are some ways they can make the most of the time and money they're spending on these trips?
From my perspective, what we again hear a lot from business owners. In fact, I think 9 out of 10 business owners in a recent SAP Concur study said that business travel is getting increasingly complex. And so we're really focused on simplicity. How do we make the traveling process easier for our customers, from booking travel to managing it to the experiences that they're having while they're traveling, all the way through to coming home and then needing to kind of reconcile those expenses with their T&D system. And so what we're focused on is providing tools that make that process easier and perks while customers are traveling, like lounge access or hotel stays that are a little bit elevated and help pamper a business owner a little bit. We're really focused on that so that entrepreneurs who are very busy and have a lot on their minds can really just focus on the travel and focus on their business and building their business.
All right, where can our viewers go for more information?
You can visit CapitalOne.com/business cards to learn a lot more about what we offer.
Thank you both for joining us today.
Thank you.
Thanks.
Mental health care has become a bigger conversation in recent years, but a lot of patients still say finding the right treatment can feel frustrating and unpredictable. More people are now asking whether care can be more personalized instead of relying on trial and error when it comes to medication. Dr. Crystal Nelson is a board-certified psychiatrist joining us to talk about new research and how genetic testing may help guide treatment. Welcome, doctor.
Thank you so much for having me.
A lot of patients say mental health treatment can feel one size fits all. Why is personalization becoming such an important part of this conversation?
Well, mental health care is a highly individualized thing. What we know is that what works for one person just simply may not work for another person. And so patients, despite this, they feel like their treatment is a one size fits all. The GeneSight Monitor Health Survey in 2026 showed us that 88% of patients diagnosed with depression and or anxiety felt that they would be more confident in their care if it were more personalized. So what we know is personalization really matters when we're talking about side effects, symptoms, treatment responses. This just can vary significantly from one person to the next. And so we want to begin to try to tailor this approach so that we get more informed conversations and better treatment experiences.
How can tools like the GeneSight test help doctors and patients make more informed treatment decisions?
Well, currently what we have is a very frustrating trial and error process. Again, we know from that survey about 13% of patients with depression and or anxiety who had previously tried a medication said only 13% that said the first medication worked for them. And so what we want to look at is using something like GeneSight. GeneSight is a simple cheek swab test that can be ordered by the clinician in office. And in a few short days, that clinician can get information about how the patient's genes may impact the medication outcomes, hopefully cutting down on this long trial and error process and creating a more personalized approach.
For people who feel like their current treatment plan just isn't working, what conversation should they be having with their provider?
Well, I think it's first important that a patient always feel empowered to have an open and honest conversation with their clinician about their treatment if they're getting a less than desirable outcome. Patients can simply ask their clinician to order a pharmacogenetic test like GeneSight, or if that is not something that they can do, they can also go to the website, genesight.com, and find a local provider that may be comfortable ordering something like this for them.
All right, one more time, where can viewers go for more information?
Fantastic. They could talk to their healthcare provider or just simply go to genesight.com to find out more information.
Dr. Nelson, thank you so much for being here.
Thank you for having me.
A lot of caregiving conversations focus on physical health, but communication challenges can completely change daily life for families too. Conditions like stroke, dementia, hearing loss, and even Parkinson's can make simple conversations difficult and frustrating for both caregivers and loved ones. Rosa-Lugo and Janice Trent are joining us on behalf of the American Speech-Language Hearing Association to talk about new research and resources for caregivers. Welcome to you both.
Thank you for having us.
How important is strong communication when someone is caring for a loved one with communication difficulties?
Well, effective communication is essential in caregiving. For example, when you have communication breakdown, everything becomes harder. Daily routines, safety, medical decisions, and emotional connection. So this new poll shows that more than half of caregivers experience communication breakdowns every day, and nearly 8 in 10 say it leaves them emotionally drained. So this isn't a small issue, it affects families deeply.
Now, what stood out most from this recent caregiver poll?
There were many issues that surfaced, but I would say that one of the strongest messages from the poll is that communication challenges are constant and exhausting. So as I said before, 52% of caregivers say communication breaks down every day. So they find themselves repeating or rephrasing what they say most of the time. And only a third of them feel that those strategies actually work. So I would say one of the biggest findings is that caregivers find themselves frustrated, sad, and anxious. And they believe that the person that they're caring for feels the same way.
For me, it was the research that said that they don't know we're out here and we're here to help. So there's good news on the other side of this, that when people come to us, when they discover that we're here and they come to us, over 88% of the caregivers said, wow, this has been a wonderful experience and it has changed my life. And that's what we want to get out. There is help out there for you.
What are some of the biggest struggles caregivers have told you they're facing right now?
Having to repeat themselves all the time, having to raise their voices when they're talking to someone. And if they're in public and they're raising their voice to someone who's elderly, it makes them look like they're very disrespectful. And they really don't like that. And then just generally being tired and exhausted by the end of the day. Those are some of the most challenging things that they are experiencing.
Another one, just to reiterate, real safety concerns. So 51%, I think it was in the poll, were concerned about communication difficulties and how that could affect medical issues and how they are handled. And 40% of the caregivers says it was very difficult to know if their loved one is sick, in pain, or unsafe. And interestingly, a third say that these communication breakdowns are affecting their own health. And that's something that I don't know many people talk about in terms of being a caregiver.
Why can getting professional support make such a difference for both caregivers and patients?
Well, I would say, first of all, help does exist and it does work. Audiologists and speech language pathologists, we're trained to support adults with communication, cognition, speech, language, and or hearing challenges. But as Janice was saying before, the poll showed that 60% of caregivers have never worked with one of these professionals, and 84% say they've heard very little or nothing about these services. So for me, that's a major awareness gap. And I know that when caregivers are provided with support and really good strategies, it makes a difference. And they note that the services were extremely helpful to their everyday life.
You've launched a new public resource for caregivers. What does it offer?
Well, it's a really easy to understand website. It is helpingyoucommunicate.org. And it does provide information about communication difficulties, insurance coverage, and how to find qualified audiologists and speech language pathologists in your specific area. And what I really like about it is that it is designed specifically for caregivers and families.
All right, one more time, where can viewers go for more information?
I'd love to reiterate, they can go visit helpingyoucommunicate.org. And I just want to say it's a simple, accessible starting point for anyone who wants to understand communication challenges and to get connected to professional help. So thank you for that opportunity.
Thank you both for being here.
Thank you.
Healthcare can still feel confusing for a lot of people, especially when you're trying to understand coverage, compare costs, or even figure out where to begin. Now AI and digital tools are starting to make some of that process a little easier and more personalized. Amy Jordan is the Vice President of Consumer Digital Engagement at United Healthcare, and she's joining us to explain how technology is changing the patient experience. Welcome, Amy.
Thank you for having me.
What are you noticing right now about the way people interact with their health benefits?
Yeah, what we're hearing from our members and from consumers is that healthcare is complicated. Healthcare is complex and confusing. And on top of that, we've got rising costs. So people are feeling overwhelmed and uncertain about what they can expect to pay. And so that ultimately leads to people delaying important preventative exams, not visiting their PCP as often as they should, which are all things that we really think people should be doing on a regular basis to really help keep healthcare costs down and keep themselves healthy. And so we think technology is a great opportunity. And so we're really focused on our app and bringing forward tools and resources to support our members.
How are technology and AI starting to change the healthcare experience for patients?
Yeah, I really view like technology is a great simplifier of healthcare. Like I said, healthcare is confusing. People are not always aware of their benefits or how to use them or where to find care. And so technology is a great way for members to come in, engage with our tools and resources, find the care they need, and really better understand their benefits, how to use them, and really take the next steps that they need to make sure they're staying healthy.
What kinds of digital tools has United Healthcare rolled out for its members?
We've been really focused on the care navigation space. So, one of the new tools that we've launched is a smart choice provider matching tool, what looks at high quality, low cost providers in our network, matching them with members based off of their personal preferences, their benefits, and really helping create a resource for them to find the care they need closest to them that's going to best suit what they're looking for. That's one of the tools that we've been investing in. The other is an AI personal assistant named Avery. Avery is really there for 24/7 support to answer questions across a host of different things: benefits, providers, claims, prior authorizations. It's really there to run the gamut and give people that tool and resource they need that they can depend on to find the information they're looking for.
All right, Avery sounds really cool. What is that tool designed to help people do?
So Avery is an AI machine learning tool that engages and learns from members' interactions. So the more the member engages with Avery, the more it learns, the more it personalizes the responses based off of the member's healthcare journey and the benefits that they have. Avery is really there to answer, like I said, any question. So what your benefits are, what you can expect to pay, your providers in the area that are in network, finding something to match what you're looking for. And then that claims process, understanding what claims were paid, why they were paid, prior authorizations if they're required, and what the status of them are. It's really kind of there as that complete resource that lives within our app. It also lives alongside our advocates if you're talking to them on the phone or chatting with them. And it really is this great resource to span across all aspects of the healthcare to empower the members to really feel like they know what they need, what they're looking for as they're engaging in the healthcare system.
Where can viewers go for more information?
If you're a United Healthcare member, we encourage you to download our app. Otherwise, you can go to uhc.com to learn more.
Excellent. Amy Jordan, thank you so much for joining us today.
Thank you for having me.
AI has become one of those things people keep hearing about everywhere, but a lot of folks still aren't really sure how it fits into everyday life. The interesting part is more people are starting to use tools like ChatGPT for practical things, organizing schedules, planning trips, even simplifying busy days. Meaghan B. Murphy is a lifestyle expert, author, and self-described ChatGPT power user, and she's joining us today with some easy ways to get started. Welcome, Meaghan.
Yay, thank you for having me.
Meaghan, there's so much conversation around AI right now. For someone who maybe feels a little unsure about it, what do you think they should know?
So I'm excited to be talking about AI because it is something that I now use on a daily basis. It's really become like a personal assistant to me. And I think that's what technology is all about, right? Giving us a little bit of an edge, making our lives a little bit easier. That's what AI does. And the cool part is that you don't need to be technical. You don't need to be tech savvy. You just start by asking a question.
What are some simple ways people can start using ChatGPT today to make life feel a little easier or less overwhelming?
So think about something in your daily life that is a have to do, not a want to do, that is time consuming, that you really don't enjoy. That's what you're going to outsource to ChatGPT. For me, that is meal planning. For somebody else, that might be organizing your finances or planning, a big move or getting ready for a job interview. What is that day-to-day daily task that ChatGPT could maybe help with?
Now, you said you use it yourself all the time. What's one way, besides meal planning, it's genuinely helped you in your own day-to-day life?
So I think for me, it's a big one in the kitchen. I will say, I've got kale, rotisserie chicken, and an onion in the fridge. What can I make for dinner? I'll use it to take a recipe that serves 4 to make it to serve 6, so I don't have to do that measurement math. The other day I was making basmati rice, and it was watery, and I'm like, why is it watery? Is dinner ruined? Slapped a picture, put it in chat. It said, cover it, turn the heat down, and I had fluffy rice. I do it with my kids. I had to write an email to a school administrator. I wanted to be firm and respectful, polite, all the things. I did a tone check on my email with ChatGPT, made a few changes before sending it along. Sometimes I'm looking at a contract. I'm like, can you flag anything that I should pay more close attention to? It's all of those little things where ChatGPT can really be an asset.
All right, summer gets busy fast for a lot of families. How are people using ChatGPT to help plan trips, schedules, and events?
So ChatGPT and travel really do go hand in hand. I am planning my summer travel for my family. We've got like this little 5-day window in July. I've got X amount of dollars to spend, and I'm really using ChatGPT to kind of weigh my options, compare itineraries. Should we go to Maine? Should we go to Colorado? Should we go to Ireland? What's in the cards for Team Murphy? And then once you get to your destination, it can be a really valuable tool. You could snap a picture of a landmark and say, tell me all about this. You can find the best coffee shop. It's like a travel agent and a tour guide all in one.
All right, where can people go for more information?
So if you go to chatgpt.com/download, you can start using ChatGPT for free today.
Meaghan, thanks so much for being here.
Thanks for having me.
Summer entertaining always seems to evolve a little every year. And this season, people are leaning into simpler gatherings, shareable drinks, and making the most of those longer evenings. There are also some fun new twists on classic hosting ideas showing up everywhere right now. Theo Rutherford is a drinks and entertaining expert with Deutsche Family Wine and Spirits, and he's joining us now with what's trending this summer. Welcome, Theo.
Thanks for having me. I appreciate it.
What are the biggest summer hosting trends you're seeing this season, and how are people making the most of those longer days?
One of the biggest things that we're seeing is that as people are on the beach, by the pool, hosting people at home, they want to unwind a little bit earlier. So instead of waiting for the last drink of the night and doing your nightcap where you finally usually get to let those shoulders drop a little bit, people are doing that a little bit earlier and having a day cap. So reaching for something that's light and social, something that they can really enjoy with their company, and something like Josh Sea Sweat Sparkling is perfect for that. You can drink it on its own because bubbles make everything better, throw some ice in there, or make a really lovely spritz that's going to help you enjoy your guests and help elongate that day a little bit, help you be a little bit more social.
The punch bowl and shareable drinks are making a comeback. What's making those feel fun and popular again?
I don't know if you're anything like me when you host a party, but I'm constantly running around making people drinks, refreshing the cheese board, grabbing somebody a beer, lighting the fire, whatever it is. So I think people are tired of having to entertain versus actually get to be with people. And I think that's what is making punch bowls really appealing for a lot of people, because you can make one batch and you're done. You can also put pretty much anything in a punch bowl, like Gray Whale gin that has this really lovely citrus note, and also this mint that really makes those really refreshing, cool drinks during the summer. Or the newest thing from Gray Whale, which is going to be the Gray Whale vodka, that has just a touch of sweetness from the grapes that we're using in the distillate that really makes any drink perfectly balanced, and you can put anything with it to refresh you during the day.
All right, you're also talking about balancing fun and connection while giving back this season. What does that look like?
A lot of people are looking for brands and organizations that are giving back to people or causes that they believe in. So about 50% of consumers shop for brands that really do give back. And it's a great thing with Gray Whale because we have partnered with the Surfrider Foundation. The Surfrider Foundation is a fantastic organization that's trying to clean up the nation's waterways and oceans. As a matter of fact, through the work that we're doing with them, we're actually trying to help them reach their goal of clearing over 750,000 pounds of trash from the ocean and waterways across the country, which that's a giant number. So what little we can do to help them is awesome. Now, you can do that, and you can have a really lovely drink like a Gray Whale gimlet with lemon and lime and agave, or a vodka and lemonade and soda water to help keep things going and keep that refreshing drink, but also know that you're giving back to a really great cause.
Where can people go to learn more information?
So for Josh, it's joshsellers.com. And for Gray Whale and information on what we're doing with Surfrider, it's graywhalespirits.com.
Theo, thanks so much for joining us today. Don't tell my boss I'm going to go have a day cap.
Chris, thanks for having me, and I will absolutely join you.
Some places carry history in a way you can actually feel when you walk through them. The National Civil Rights Museum in Memphis has reopened its legacy experience with new exhibits and new insight into the civil rights movement and the legacy of Dr. Martin Luther King Jr. Dr. Russ Wigginton is the president of the National Civil Rights Museum, and he joins us now. Welcome, Doctor.
Thank you for having me so much.
The museum is celebrating 35 years with this reopening. What does that anniversary represent for you and for the museum itself?
That represents a really important and powerful moment for us to capture the almost 60 years since Dr. King was killed on the balcony here at the Lorraine Motel. It allows us to make present-day civil human rights work relevant to a couple generations of people and to help them get connected in a much deeper and intentional way. By grounding so much of the work and the legacy experience in Dr. King's last book, Where Do We Go From Here? Chaos, Our Community, we explore areas like education, poverty, housing, nonviolence, and gender, which are still areas that our society is grappling with today. It also reminds us that the movement has always and continues to be a movement that focuses and needs young people, and that ordinary people do extraordinary things if we're going to make progress.
What can visitors expect from the newly updated legacy experience?
They can expect a fusion of the latest technology with traditional artifacts that are thoughtfully put in place to pull together relevant and timely stories in which people across generations can connect with, that they can see themselves as a part of. And this comes through in multiple other exhibits, including how social media, for example, can be used and has been used through the Black Lives Matter movement, how social movements have grown out of the principles connected to the civil rights movement, so movements of today, and how many change makers there are out there, people whose names many of us know, but also who we may not know, who are literally change makers today.
We've heard there are newly interpreted documents and information tied to Dr. King's assassination. What can you tell us about what's been uncovered?
The documents that we are in charge of since our founding are fundamentally the evidence of the state of during the case connected to Dr. King's assassination. Our utilization of those documents is for really, we think about context for people to understand why Dr. King was killed. So if they're on a journey and curious about perhaps even who did it, they can determine that for themselves by exploring these documents. But it really is important that they understand why he was killed in order for us to move forward as a society and think about how we can make a difference.
The museum also focuses on where the civil rights movement goes from here. How are you encouraging visitors to stay engaged beyond their visit?
We certainly want visitors to think about what they will experience in our last exhibit around what they hope for, and we give them an opportunity to answer that question. And then they can visit us at civilrightsmuseum.org to learn about our stories, our museum, an opportunity for them to give us their powerful stories, and we can include them in the experience as well.
Where can people go to learn more or plan a trip to the museum?
civilrightsmuseum.org. You can learn more about the legacy experience and the sacred ground of the Lorraine Motel.
Dr. Russ, thanks so much for being here.
My pleasure. Thank you.
That's it for Rise and Unwind. Thank you so much for watching. Until next week, I'm Chris Malony. Thanks for spending a little time with us on Rise and Unwind.